Welcome. Questions of a therapist. I feel lost. Namaste. The first patient and the first session is an unforgettable experience for every therapist. Every therapist has his and her own. However, as you go into it, often you feel lost in many ways at many places. To eliminate our journey of getting lost, we have for guide psychoanalysis consultant Dr. Himanshu Vaidya. Namaste, sir.
Namaste.
So one feels completely lost after meeting the first patient the first time with so much of excitement and pressure to give relief to people. What is it all about?
It's very natural. You are doing something difficult, not easy to do. And it's a clinical situation. It's a situation where the person has been to 4 other people before he comes to you. So you are
True.
before a difficult situation. And you are just beginning. So there is this anxiety of beginning something anew. There is anxiety related to one's own capacity. There is anxiety related to if or not I will be able to do it. You are fumbling with the concepts in your mind and they are not coming up. All that you learned in the class, you feel you will be able to recall at will, doesn't come up at will. So this is one part of it, the sheer newness and the cognitive difficulty of it. But there is another part which is deeper and more important. And that is, once the patient tells you the story or the informant tells you the story, you have the symptoms and the story. And unless you bring in psychoanalysis or any school that you are following, you can't connect the symptoms to the story. That is where you feel lost, because you are exactly in the same position where the patient and his family members are, and where everyone else in the society is. That everyone knows these two things. Not as deeply as you know it, but in a generic, summarized way. Especially the family knows it. They know his story, at least what is on the surface they can know. And they know the symptoms. And they are lost because there seems to be no connection between the two. Or if there is, it's difficult to understand very clearly what it is. And even if you get a faint idea, the question is now what to do about it. So the young therapist who is looking at it the first time, and this is not only first time, you get lost for quite some cases. And it is not as though getting lost stops after the first 50 or first 100 cases. Anytime in your life you can get lost. And this will bring us to a deeper analysis of why the therapist feels getting lost. But let us to start with the discussion, start it with this, that unless you are able to do pathogenesis, and this is the key, unless you are able to do pathogenesis by application of the theory that you are following, you will be as lost as the patient and his family members and everyone else. Because the only difference between you and them are two. One, you can do therapy, and second, before you do therapy, you can do pathogenesis. So how do you connect the symptom to the story? How is it that from this story, a given life story, symptoms have emerged? The only connecting thing between the two is the school you are following.
Right.
Inability to deploy psychoanalysis on the case history is what makes you feel lost. That you have a heap of information and you find it difficult to apply what you know, in our case psychoanalysis, to that heap of information. Because unless you separate that heap of information into important and unimportant, and unless you are able to understand the important in terms of psychoanalysis, which will happen only if you bring to bear psychoanalytic theory upon the important information. You won't be able to make sense out of it, and you will be as lost as the patient. You will all be in the same boat. So the key here is to deploy the school that you know, whether it is psychoanalysis or CBT, DBT, REBT, whatever it is. It is only the school that you know that when you deploy it upon the case history material, and you are able to make sense of how the symptoms have developed, that you get clarity. Until you get that clarity, you are lost, you are confused, right? And you don't know essentially what to do. You may try whatever comes to your mind. That doesn't mean that you are at ease or you are fairly convinced that results will come. You are essentially in a trial and error mode. That is not the path of science or conviction. It is the path of trying out all that you know. That you
Right.
know 5 approaches, you think, let me try out, something will work. And whatever works, I'll take that forward. That's very different from being a well-grounded therapist. So trial and error is not something we are looking at as a goal. That is the no option situation. It's a last situation, that when you can't make sense out of the case from any school that you know, you take this option, let me go ahead and see what works. And in a sense, it's an experimentation with the patient also, which is ethically also not a very good thing. So the core is this, that if you cannot recollect your school and apply it upon the case history, and after that application be able to explain to yourself, if not to others, how the symptoms have developed in the light of the school that you have applied, you will feel confused. And once you apply and you are able to figure out that in the light of my school, this is how the symptoms have developed from the story, then you get a clear idea of how to heal, because healing always is a function of pathogenesis. Right? If you say Oedipus is the cause, in therapy, you have to focus upon Oedipus. If you say the split is the cause, in therapy, you have to focus upon the split. If you say attachment is the cause, in therapy, you have to focus upon attachment. There is no way out. So therapy always is a function of pathogenesis. So the healing plan always will reflect the pathogenesis that you have arrived at. And the more schools of psychoanalysis or therapy you know, the better psychopathogenesis you can do and better healing plans you can make. So this is one very important aspect of getting lost. And it is not that this cannot happen in the mid course of the therapy or towards the end of the therapy, or that it cannot happen after you have been in therapy for 10-15 years. It can still happen, but not as much as before. In the initial period, you are actually and really lost. And the core is this inability to recall psychoanalysis and apply it and arrive at a successful and acceptable pathogenesis, and to derive the healing plan from pathogenesis. Now, the trouble is this. Okay. Let us rest for the moment at this point, and we will go into the trouble slightly later.
Also, the feeling of being lost in the beginning years of the practice, it's owing to the complexity of the cases. Even if the therapists are getting a very clear pathogenesis, but due to the complex coexisting pathologies, for example, there's 2 or 3 personality disorders prevailing. Underneath, there is the spectrum of anxiety issues and other thought-related and attachment-related issues as well. So, what to cater first to generate relief sometimes can also be misleading to the newly practicing therapists, and at times even to the very well experienced therapist.
Very good question. Very good question. This is also true. And this goes to, let us say, if we put all therapists together, even the seasoned ones, the wise ones, knowledgeable ones, and see the universality of this problem occasionally even with them.
Right.
This takes us to the very nature and the stage of evolution of psychotherapy as a whole. That the entire science of psychotherapy is a young science. It is not a mature science. Unlike more mature fields of knowledge like physics or biology or chemistry or mathematics, we are not essentially a mature science even today. We are an evolving young science. So there are areas of ignorance, there are areas of controversies where things are not settled. And this includes even fundamental areas like the model of the mind, pathogenesis, healing approach, technique, testing. All areas in this area are contested areas. So the very nature and the stage of evolution of the science is such that it is natural that everyone would feel lost at some point if very complicated cases come up. So that is the very stage of development of the science reflecting in that problem.
So, in general, in the beginning itself, the newly taught therapists have difficulty in following the psychotherapy process itself. Why it is?
It is because the human mind resists structured working, any systematic working. We
Okay.
want to be in that Eden of garden with only heroes and no logos, where it's free for all and there are no constraints. So we want a situation where you say, I will do what I like and call it psychotherapy. That is what is the fantasy. And often that fantasy and that addiction to reverie and the addiction to heroes without logos overwhelms us. So the first point is about this very human tendency, very deep in our nature, that we resist reality, we resist structures, and we want a no boundary free for all heroes. One part of it. Second part of it is psychoanalysis in particular is neither easy to understand, nor to recall, nor to apply. So there is a difficulty, the intellectual difficulty of doing so, which may not be as true equally in other areas which are more simpler to learn and apply.
Right.
I would cite CBT, I would cite RABT in that context. That compared to psychoanalysis are much simpler to learn and apply.
Simple. It's all ready-made tools. You just need to put across. Nothing.
Yeah, it's more standardized, more easy to apply. And the fundamentals of it are not so numerous and so contested as in psychoanalysis. They don't have that inter-school Mahabharat which we have in psychoanalysis.
True.
That we have very great number of schools and there is a Mahabharat between them. That situation you don't find in many of the other schools which are more simpler.
Simpler.
Then there is this question of practice. That even for a well-trained analyst who understands well, who is thorough in these studies, the question is of practice. And with practice, some of this feeling of getting lost goes away. So one of the elements there of feeling lost is the lack of practice. And after you see a few cases, that component of feeling lost, which is based upon practice, that component goes up. You also start developing a confidence that theory works. after a few cases. And when you develop that confidence, some part of your anxiety goes away, and therefore the feeling lost part also goes away. Knowledge consolidation by application is very important, develops your confidence. Over a period of time, if we are in good supervision, our own difficulties, especially of narcissism and other unconscious pathology which is working out in the therapy session, that also gets addressed. And often because of that, if you are feeling lost, that goes away. So it's difficult to be structured and apply the structure and follow the structure. But once you do it 15-20 times, it becomes natural. It's like you are trying to carve a design on stone. It's difficult to make the first line, but once you make the first line, deepening it is not so difficult. So the same with the unstructured, untrained mind, that if you push yourself and force yourself to follow the 7-step psychotherapy process, after 15-20 times, it becomes natural, becomes very intuitive. So this is the whole thing about feeling difficult to follow the process, and part of the getting lost is because of not following the process.
I really appreciate the emphasis you made on the 2 points that the mind resists the training system and the structured format in the search of free reverie and freedom, also along with one's own pathology, which reminds all our future therapists and co-therapists that self-work and being in the therapy is very mandatory for the practitioners themselves too, so that they do not get stuck with their own pathology, and that is the reason why they're getting lost into the sessions.
Right.
That was a very needful reminder, sir. Thank you so much for that.
Thank you.
Sir, how does getting lost play out as we go along? Does it just not only gives us the clarity of our own versions and the human life, how we interact, owing to the transference, the resistances, self-learning in the therapy room? So as the therapy proceeds, what all is happening there? What is the what are the significant landmarks where the people get lost as we move ahead?
So we started off that the first therapist, the therapist who looks at the first client, gets lost with NAO. So the first getting lost is getting lost with NAO. Now the second getting lost is getting lost after therapy has started. Because as we said, getting lost does not end only with the beginning of the case. It's not that you get lost only after having case history with you. You can get lost after 10 sessions, after 15 sessions also, in the middle of the therapy.
Absolutely.
So how does it happen actually? First reason is, as you go along, the facts build up. And when too many facts build up, it's difficult to make a coherent structure out of it, because too much material is laid out to you.
Yes.
So when the person is telling you about the facts of his life, about his dreams, about his fantasies, about what he thinks about you, what he thinks about somebody else, there's such a large heap of information that you get lost only in processing that information.
True.
So one is the overload of information itself. And there the key is to separate the important from the unimportant and let the unimportant go. Now this is a very dicey thing. In a generic sense, no who can object to this. If I say that the key is to separate the important from the unimportant, and it would be 20-80, then identifying the 20 important and focusing on it is the key. As the first argument, absolutely correct.
Okay.
But when you go to implementing this argument, the specifics come up, and there it becomes very, very difficult. And the difficulty is very important to understand and very interesting. The difficulty is what is important and what is not important. Let us say you apply the generic argument successfully, that you have a huge heap of information after one, say 100 sessions or 50 sessions. So
Right.
50 sessions have gone by, you have a 1 hour session, you have 50 hours of somebody expressing himself. And that's quite a heap of information. Now, if you can separate the important from the unimportant and focus only on the important, it will be easy, or you feel getting lost because there's too much of information. So if you don't want to get lost, we have to separate the important from the unimportant. Now, this is where the catch is. What will seem important to you is based upon your training. So what seems useless to you might be very useful to somebody else. Let me take an example. Let us say somebody with generalized anxiety disorder goes to a psychiatrist. The psychiatrist asks him how many times he feels it in a week, how much duration it lasts, what is the manifestation, what is the duration, what is the intensity, what is the frequency, how many years it has been so, what relieves it, what aggravates it, and so on. The patient replies to all of this and then tells the psychiatrist, you know, last night I had a dream. Psychiatrist most probably will say, okay, we can discuss that later. Let me just write a prescription. For him, dream is a useless thing. If the same person had gone to a psychoanalytic psychotherapist, right, this would be the most important piece of information.
Exactly.
So what is important is based upon your training. If you know how to use and analyze a dream, it's very important. If you don't know, like a psychiatrist, you are not trained in dream analysis, you don't know the significance of dreams. And this has nothing to do with the way you practice healing in the sense of prescription. So his prescription is not going to change based upon the content of the dream or analysis of the dream.
True.
So for him, it is not useful, but for us, it is very useful in how to do therapy. So it's like this. In India, you have those juicer machines manually operated. On the roadside, you see it. There are some juice machines where you can draw juice only from only from oranges and
Awesome.
lemons.
Sweet life.
You cannot put sugarcane in that. And there are sugarcane juice machines in which you cannot put sweet lime and oranges. The same is true for each school. Each school is like a juicing machine that you can put only certain types of fruits in that machine based upon the nature of the machine. So the input that you need is of a particular type only. So in the case history also, this is important. If you know only Freudian school, you will ask case history information in a particular way. If you know Kleinian and Freudian both, number of questions will increase. If you know 5 schools, it will be even more. So the more schools you know, more questions you will ask. Because each school will require a different set of data to be put into that machine. The Freudian school will read data on the psychosexual development. That is the only data that machine can process. If you talk about the split, the Freudian machine cannot process that data. So if the person is talking about split, you have to put it into the Kleinian machine. So the more machines you are adept at, the more data you will seek and more data you will process, and more data will seem important to you. Now, this is as true in case history taking as true it is in therapy session. The more schools you know, a larger width of data will seem important. But whatever schools you have to separate between important and unimportant and let go of the unimportant so that you don't feel lost. Now, if you don't know adequate number of schools, some of the important data may also get lost as unimportant. And that is true. And there is no way to avoid it beyond a point, because nobody can be an expert in more than 2 or 3 schools. In fact, you can be expert in one and have appreciation of many, but nobody can really be an expert in many schools. So it's inevitable that some of the data which is important will be deemed unimportant and lost by the therapist. That is universally true in some measure or the other. So this is the second part of it, the heap of information. The third part of it has to do with very difficult emotions put into you in terms of projective identification. That if the patient is feeling lost, you start feeling lost. If the patient is feeling highly anxious, you start feeling highly anxious. If the patient is having attack on linking, you start facing attack on linking. So because of this projective identification thing, right, you can start feeling lost. There can be a collusion of resistances, that both of you don't want to go at certain areas of the patient's life, and therefore both of you unconsciously decide not to go there, and one of the defenses can be to feel lost. So there is a collusion, an unconscious collusion. It's like, let us say, the patient's mother is sick and the therapist's mother is also sick, and both of them have this difficulty of dealing with the impending death. So there is an unconscious collusion where both of them unconsciously decide not to bring up this area.
Skip it.
Skip it. So sessions go by, but this area never comes up.
That reminds me of a client who constantly avoided and resisted to talk about the father. But yes, somewhere there was no collision, so I could actually pick up. But when I picked up, they ejected out of the therapy.
Correct. Correct. So this was like too much for that person to handle. So then there is the last part of the technique. That inadequacy of technique can also lead to this position where you start feeling lost, because you are not equipped in terms of technique, in terms of intervention, what to do. That in this situation, what to do, right? And when you are not equipped in that area and you do something spontaneously, whatever comes to you, and it does not work, and you try something and it does not work, and after 3-4 trials you feel lost, because it is a point where from a technique point of view you don't know what to do, and somehow the supervisor has not told you what to do, or you never had supervision. Anything of that sort is possible, but there can be a technique difficulty. So the fourth one is the technique difficulty, and the fifth one is too much involvement of the therapist himself, that the therapist has got effectively involved. I'm not saying essentially romantically and sexually involved. I am making a wider argument of any sort of effective involvement. Then you have a stake in the process, and you cannot have a stake in the process. You have a stake in the well-being of the person, no doubt, but you cannot have a personal stake in the process. Neither ideological, nor financial, nor emotional. So financial is okay, frame takes care of it, but in the soft interactions of the therapy session, what happens often is the ideological and the emotional stakes start getting built in over a long period of time. And then you are no longer an empire, you are a player.
Okay.
And that is not where we wish to be. We cannot be players in the game. Right? To be umpire, not in the sense of a superego umpire, but in the sense of the neutrality. I mean, we are not there to give out or reward somebody with 4 or 6 as a cricket umpire. But to make the point, I think the point would be that we cannot be involved. We have to stand apart. If there are 2 players playing a game, we cannot join the game.
So basically, the unilateral flow of the psyche minus the transference and the holding.
Correct. So we can't get into the process, involved in the process personally. So we can't emphasize that enough as to how important it is not to have a personal stake in the process. Because any personal stake in the process will start bringing in elements which are not ideal. They can be elements of feeling angry. They can be elements of directly or indirectly communicating your expectations to the patient. Worst would be direct communication. It's a complete breach. It's an acting out. Right? Or it would be a very subtle way of channelizing the psychoanalytic process. That you start directing the psychoanalytic process in a particular way because you have developed a personal stake in the process. And
it can be as simple as having the urgency to have a breakthrough in the therapy.
Even that,
feel confident, peaceful.
Yeah, if it goes beyond a point, it becomes your personal agenda.
Exactly.
It crosses the line of your desire for well-being and quick healing. That is a very noble desire. But when you start pushing it as an agenda, that is where it becomes a trouble, because now you're demanding from the client to be well on your terms. So this is where distance is very important. So when you start getting personally involved in some way, you have a stake in the process, and things are not going according to that stake, it can lead to very difficult emotions of irritation, anger, anxiety, or just feeling confused, where these things get internally projected or internally focused on your own thinking process if they can't come out in any other way. So this also can be a point of getting lost, that you have developed a personal stake, but you cannot say anything explicitly beyond the point, and the internal dynamics are very troubling because of it. So these are some of the situations where in the middle of the therapy or towards the end of the therapy, not at the beginning, but you still can feel lost. And this can happen to any experienced therapist, no matter how long and how deep the process has been. Because this is such a profession, it's a profession of perpetual danger.
True. So beyond ethical virtues and morality, does it involve the inner working of the therapist himself?
It does. We are nearing the time for this session. Can we continue this in the second part of the session? It's a very important area that you opened up.